All right, so thank you for now. Right, up next, our Kim Yeon-seung joins me back here in the studio with more coverage of the events on the local front. Right, Yeon-seung?
Yes, thank you for having me.
Right, then Yeon-seung, let's start with the number of severely ill COVID-19 patients.
Right, so I want to mention that it is pretty concerning that we are seeing close to 500 severe cases as of this Tuesday. That is a new record, and it's the 11th day that the country has seen more than 400 critical cases. That's up from around 300 that we saw in September, and there was also a time back in July when the nation saw fewer than 200 critical cases. So this is quite the surge compared to the figures reported earlier this year. And this is starting to take a toll on the nation's healthcare system, especially in this whole metropolitan area. Currently, more than 3/4 of all ICU beds are filled in the capital region.
Right. Having said that, Yeon-seung, how are health authorities looking to tackle this growing challenge?
Well, health authorities did say earlier that they were going to pull the emergency brakes on the further easing of restrictions if data points to the nation heading towards a full-on health crisis. And one of the warning signs they mentioned is the nation's ICU units filling up more than to 75% of maximum capacity. But this doesn't mean that the country will immediately tighten its curbs as soon as we hit that mark. Health authorities intend to look at all the factors in play and will take prudent steps to curb the spread of the virus. So if they see infections spreading among the unvaccinated, the plan might be to expand vaccine passes. If authorities see outbreaks centered on social gatherings, they might lower the cap on meetings. If they feel that certain venues are more vulnerable to cluster outbreaks, they're going to strengthen measures specifically in those areas.
Right, I see. Meanwhile, Yeon-seung, what other measures then are being taken to further contain, that is, the number of critical COVID-19 cases?
Well, our vaccination campaign has always remained important, and health authorities are addressing this by possibly speeding up the booster shot campaigns. Many of the critical cases are concentrated among the elderly and those with fading immunity. So in response, Health Minister Kwon Duk-chul mentioned further shortening the interval between the primary and booster doses. Currently, South Korea recommends people aged 50 and over to get their shots at least 6 months after being fully vaccinated. And people working at high-risk facilities, they can get their jab as early as 5 months after full inoculation. However, Health Minister Kwon Duk-chul said that health authorities are currently reviewing the optimal schedule for booster doses, and this could mean top-up shots could be given 3 to 4 months after the final dose.
I see. All right, Yeon-seung, thank you for now, but do stay for the broader talks.